Faccio da solo, la porta dello schiumale. Così pelaku, faccio. Non potrei dire, ma così faccio. Allora faccio una meno. Non te ne so. Faccio tanto. So we are in the OR with Dr. Ziri and Dr. Thomas and also Dr. Mamu, who is one of the seniors. So we saw a tibial fracture case.
Yeah.
I mean, it's a very common injury, isn't it? Severe compound tibial fracture. That's a very common case for you.
Yeah, it's very common.
Yeah, and the reason why people get injuries, you know, in this area because of
assault and road traffic accidents.
Yeah.
The two major causes are assault, either bullet injury, and followed by road traffic accidents.
Yeah. And also we've seen some people who had injury from work, construction workers, and farm workers.
Yeah, fall down injuries.
Yeah. So they have, some of them come from a long way, long distance.
Yeah, some come after 2 days or 3 days with recontaminated dirty infected wound, and occasionally we see patients who come with already maggots inside the wound and open fracture.
So you did something different today?
Yes.
Yeah. So this is the second pedicle flap that we have done.
Yeah.
Usually they're on the ward waiting for granulation for secondary intention.
Yeah.
How long would they wait?
Usually weeks, maybe 3 to 8 or 3 to 6 to 8 weeks.
So maybe 2 or 3 months.
Chisel the bone,
so
that it will help the formation of granulation tissue, and once the granulation tissue has formed, we can proceed with splitting a skin graft.
So Dr. Sinha, we did a pedicle flap today.
Yeah.
So that was something that we would normally use to resurface a tibia back home, wouldn't it?
Yeah, it's one of the options that we have for lower limb reconstruction. The good thing about today's case was Dr. Ziri was involved yesterday in assisting the first patient that we did, and he did the case today. So all credit to him, because there's no lack of surgical expertise, because I was told by Dr. Mamu, you see nearly 4 tibial fractures per day. So there's no lack of clinical material as such. It's just a change in the concept of wound cover. The fact that they are already skilled at taking skin grafts and the principles of raising a flap, I think I'll let you answer. How did you feel when you were raising the flap? Did you think there's something?
I was excited because until now I thought it would be a very difficult procedure, but since yesterday I saw it being done by Dr. Sunil, and today we were able to do it. So
it was good.
It was very nice.
Yeah, it was very nice. Okay, and so that means that potentially these patients, they will have treatment speeded up instead of being on the ward for 2 or 3 months. If you learn this technique of putting the flap on, then you can speed up their treatment.
Definitely.
So that makes their life easier. Obviously saves the hospital and the health system money. Yeah. Okay.
Now the other thing I hope is that he'll be able to pass this on to the other residents. So there should be a sort of a domino effect with the other people being able to do it. And he's one of the senior most people here. So next year when he finishes and starts in another hospital in the east of Ethiopia, then he'll be carrying that skill mixed with him, and hopefully people like Dr. Mamu and others will be able to do the same.